Kia ora, ni sambula vanaka, talofa lava, malolelei, and of course, warm Pacific greetings to everybody tonight. Unfortunately, we like to do this Talanoa session live on Facebook, but due to technical difficulties, that's all right. We have recorded this panel for this evening, and just to let everybody know that the focus for tonight's panel is just a community response following today's announcement by the Prime Minister. Now, before we move on, I'd like to introduce you to our panel, starting with a familiar face that has been across many of our Pacific campaigns during this coronavirus period, COVID-19 period. Dr. Appi Talemaitoga, thank you very much for joining us, Dr. Appi.
Vanaka Johnson.
And of course, she's featured in a number of our Cook Island language panels. Nurse Apii Vavia-Nore, thank you very much. Kia ora, Appi. Thank you for joining us this evening.
Kia ora, John.
And we bring in our youth voices for this evening because we feel it's super important that a number of our youth is involved in this conversation. So from the Do Good Feel Good team, Fereni, Peti and Sally Pritchard, thank you very much, ladies, for joining us.
Awesome to be here.
And last but not least, Tapuvakai Vea, thank you very much, Tapu, from the Cause Collective team. Thank you, brother, for joining us this evening.
Hello.
All right, and just to reiterate, following this afternoon's announcement by Prime Minister Jacinda Ardern, currently 29 cases, over 30,000 tests done in around 48 hours. I guess we know, well, for those that aren't aware, maintaining the current alert level settings, which is alert level 3 for Auckland, and for the rest of New Zealand, alert level 2. And it's something extra that was announced today is that the wage subsidy has been extended. So as I mentioned, we're here to get some reaction from our members of our community, but also making sure we are in line with the health messaging and also what's being advised by district health boards and the Ministry of Health. And I'd just like to remind everybody, if you're new to Prepare Pacific, this is an initiative supported by the Northern Region District Health Boards, Auckland, Waitemata, Northland District Health Boards and Counties Manukau Health, with support from the Ministry of Health here in New Zealand. So without further ado, let's get into our panel for this evening. And I guess we've had a few hours to kind of reflect and kind of take in the announcement, and just want to hear from each member of our panel this evening. What was your initial reaction? And maybe if you could also tell us, or maybe if you've even heard, what are some of those responses from your close networks, whether it be your family, your friends, or members of the community? Let's start with you, Dr. Appi.
Oh, thank you. Mbulavanaka to everybody and to my fellow panel members. I kind of expected that they would extend the lockdown. I didn't see any evidence to go to level 4, so I was quite pleased they stayed at 3. And interestingly, today at the clinic, a lot of patients kind of said that. They said, oh, they're going to extend it, aren't they? And I said, I don't know, maybe. But they were kind of asking me as if I knew. People, I think second time round, I know at the clinic, they were used to it. We just stopped all face-to-face consultations. So when it happened earlier this year, there was a lot of anger from people. What's this about? Why can't I talk to you in person? But it was really, when it happened earlier this week and today, they were just like, oh, well, I rang them, I did video consults, we were laughing. And so, yeah, it was kind of expected. And I think it's good for us to just hang in there, wait for another week or so to try and contain this virus.
Yeah, thank you very much, especially letting us know what's happening from a clinic point of view. Let's go to one of our young ladies here. Sally, what's been the reaction in your side of town?
I think the initial reaction is sort of maybe just a wound in how we were progressing out of our first lockdown. I think we had come back to sort of some normality as people and as a Pacific community. rejoining and regrouping with our family and friends, and again back into society. But I think the reaction is probably it sucks, but it's I'll say as it is, it sucks, but it is what is going to keep us safe and moving into this next 2-week break, as well as lockdown, but as well as to sort of just see how we can be better from what we were doing before. I think that's what it is.
And you're right. This Ellie, to keep us safe, and we're going to kind of visit those, the ways that we can keep ourselves and our families safe shortly. Fereni, let's hear from you.
I think initially everyone was just chill about it because it happened before, but then as soon as we had a case from church come up positive, that completely changed everyone's vibe around me. So then that's when everyone started stressing and worrying and panicking, sort of trying to get tested. But yeah, other people are kind of angry, maybe at the fact that it could have been stopped earlier. Yeah.
Fair enough. Yeah, fair enough. That's totally good. And we're going to come back and revisit the case in terms of church and your own experience over the last couple of days. Tapu, brother, what have you been hearing on your side?
Yeah, I think two things. One, probably gutted, like Sally said, we're starting to head into some normality. I think, a lot of the activities and that we're starting to build, sports games, different activities starting. People are looking to, I guess, travel across New Zealand and that. So yeah, the big gutted in that sense that sort of stopped. I think hopeful more around, that's a bit closer to home now with the cases in our community. And I think, and a good thing, we know what to do now. We can take the learnings from the previous times and just apply it to now. And I think, but gutted in terms of the activities you can't do.
No, thank you. And last but not least, Nurse Apii. Has there been anything that you've heard on the work front, or even in your own networks?
It was expected. It was to be expected that it was going to get extended, and I guess it is a good thing that it's extended. So it's just for our safety, but for me personally, because I've got 2 young children, so it's just interruptive with school, but it can't be helped. So there's a lot of online learning for them as well. And with me with work, the last 2 days I'm on uni, so I've been at home, so which is good. Yeah. So
I think you pointed out something really important there, is the disruption to schooling, the disruption to university as well. I know that there's quite a few of our university students that weren't able to graduate during this period. So highlighting that as well, that it's not only around employment issues as well, it's around our young ones too. I want to just lay it out there for everybody. I know people said that is expected, but how do you think you're going to handle this? Like maybe Nurse Apii in terms of being a mother in a schooling space. I mean, we've already had one go at this, right? We've already been in lockdown. So are we better prepared for it? So yeah, just an open discussion to the floor. How are you going to prepare for this space? Feel free to jump in.
I think you're right, Johnson. We've been here before, and I feel confident that we as a community can do this again. And I'm sorry to use a medical model, but Pacific people led the way in the number of tests last time. Pacific people had the lowest rates, and to me that just reassures me. It's like, come on, people, we can do this. Let's get tested. This is what we can do. And, we made a lot of sacrifices last time. People talk about the sacrifices, but Apii was just talking about family sacrifices. A lot of our people couldn't go to church, couldn't go to funerals and all of those things, which is not easy for a Pacific family. Sometimes you can think like it's disrespectful. You're not acknowledging your loved one that's passed away. But I know other communities don't see it like we do. So I think the fact that we've done it before, it's going to be hard, but we'll do it again. I'm sorry I'm talking too much.
No, that's fine. Fereni, can I revisit in terms of church? You know, what's the plan now? How are you as a family and as a wider church family? How are you handling this? What's been the advice that you've been given, especially considering there's a positive case there?
So we've been given, as soon as they found out, they told us to all go get tested. And I feel like we've all done that. Not only that, but we've prepared an online program already, and we've been running it since the first lockdown, and that hasn't stopped. So we've always had church online since the get. And we're pretty much sorted because we have services in the evening and in the morning.
And if you could just share with us the testing experience that you had, and I believe your family as well.
Yeah, I was lucky enough to get tested at my GP, but my family weren't. They had to go to the new setup in Mangere that was just put up today, and they had to wait there for hours. Many of my church family, they had to wait for hours, like 3 going on to 7. They were there. Mom told me to pack snacks and waters in the kids' bags just to make sure that they were set for that long wait.
Yeah. No, thank you very much for sharing with us that. Sally and Tapu, feel free to jump in here. But is there anything in specific that you're going to prepare and help handle this in terms of your own families, Tapu and Sally?
I think just taking it easy. I think first time round when we were preparing, I think we packed food for a week. Realistically, it was just a 1 day shopping for the whole next 7 days. So I think we can ease on that because the lockdown weight gain was not pretty. So I can speak on that. But I mean, I think when we talk about preparation now is to be at ease, take it day by day as a family, be informed, watch the news, connect within your own households. I think it's a good time to always reflect when we are given chances like this, as weird and interesting and very different to be in as a space, as a Pacific family, because we're always on the go and everyone's busy with church, work, sports. I think this is a great time to maybe reflect on what's to come next. Realistically, it's just supporting my younger siblings with school. So I have a newly year 9 younger sister who's finding it really hard to do online studying just because she isn't having that contact support from her teachers and her mentors. And then my younger brother, who's in his final year for intermediate, he's just finding it hard to sort of just have some more support in finishing intermediate. That transition from intermediate into high school is very important. So I think I feel for a lot of our younger students in this time, as well as university students, because that wraparound support isn't there in this time.
Yeah. Thank you for sharing that with us and stepping up for your siblings as well. Tapu, I believe you're you quite well versed in, especially in the wellbeing space with your work in the Cause Collective, and I believe you like to do the press up challenges and whatnot. But what would be your advice especially around wellbeing for our people?
I think so. Just 2 things. Just going on what Sally said, I think for me, personally, for my family, it's just giving my parents clarity. English is not their first language, and so we always have conversation. They always have a lot of questions around COVID, what's happening out in the community. So and those things, I've got siblings living with them, and that, so that just giving them that clarity that it's all okay, and just showing and Talanoa in the language that they grew up on was really good. And then for the wellbeing space, I think a big what I've been pushing, particularly in our workplace, is just ensuring that that the team looks after themselves at home. Going home, we can get muddled up with work life, family life, but just being real clear that, you know, you're not trying to merge the two. You know, it's your home first. You know, you got your family there. To look after them, and the rest will take care of itself. And whatever ways you want to look after yourself, you know, a lot of the team members they like to get into the physical stuff, seeing more around the mental side and the spiritual side. It's just finding what's real unique to yourself. And for me, it's just ensuring that that's part of you. And because I think what was sort of experienced for the previous one is just around the mental fatigue, and you know, mental fatigue, and particularly around our family life. You know, complex issues, things that can sort of weigh us down, but just the ability to do what makes you happy, I guess, and just really looking after yourself. And I think for me, that's always the philosophy: look after yourself, and everything else will look after itself.
Yeah. No, thank you for that. I want to move into now. You know, starting to talk around the testing and the health space. I guess especially with Dr. Appi and Nurse Appi. Probably first with you, Nurse Appi, in terms of testing. I know there's a big push for testing, but like Fereni touched on earlier, you know, there's lots of waiting. I believe that the messaging is to go to your GP or call your own family doctor first. Can you give us some advice around testing and maybe how can we save some time?
That's really interesting because when was it announced that we were going on? It was Tuesday, right? So Wednesday, because I worked at Middlemore, and like I work across both sites, Middlemore as well as Super Clinic. So we catch the shuttles across. But yeah, there was the traffic block at the Witty, the testing station there. So like so police was there, you know, thinking the traffic, diverting traffic, and yeah, it was just, so I don't, with the drive-through going through getting tested, but yes, so some people can contact their GPs to get, to go and get tested, like in the GP practice.
Yeah. And what about you, Dr. Appi? Do you have anything to add in that space, especially some advice for our family? Yeah, around getting tested.
Yeah, I think what Fereni said should be kind of packaged and broadcast on social media. You know, that she was lucky she got tested at her doctor's. It's free everywhere, whether it's the testing station, the community-based, after hours, or your GP. All you have to do is go and have a test. I can tell people there's no queues with your doctor or at the after hours. You just get triaged, they talk to you, they do the test. All you have to say is you've got symptoms or you're a contact of any of the cases, whether it was from church. We had a family of 7 today, and that was from preschool contact that we did. Or if you were a workmate or whatever. I just wish a lot more of our people knew that they can just go to their doctor and get it done for free, rather than, you know, waiting for hours in the queue. Yeah, it's we haven't been very successful, so I think you've got to hire Fereni to broadcast it to everybody.
Yeah, and that's important to note. You know, saving time, and I think that is key. Like what Tapu was saying earlier, that is key where our young people can reiterate that message in the various different languages to their parents, where English may not be their first language. So that is a vital family connection there as well. So as we understand testing, just to reiterate again, go to your family doctor, call your GP, organize it that way. It is faster. And at last option, then you can go to the community testing sites. Am I correct?
Absolutely.
Right.
Yeah. I mean, they'll test you anywhere, but go where it's easy.
Easier.
Yeah. Now, just before we wrap up, I understand that there is still a lot of anxiety in the community at the moment. There is still a little bit of fear, probably a lot of uncertainty as well. So I really love to hear from you, each and every one of you, lastly, before we wrap up, around how do we keep our people calm? What would be your advice in keeping people calm? Let's start with you, Nurse Apii. Especially, before I just start, especially because this is not just a South Auckland case. Cases are all across Auckland, and as we're starting to see, cases are starting to pop up in various different parts of the North Island. You know, we saw Tokoroa today. So, Nurse Apii, what would be your advice around calm for our community?
I think it's just about reassuring our families and friends that it's okay, because we have been through this before and we've come out of it, and it's just maintaining hand hygiene, all the staying home when you're not well, and it's just obeying all these restrictions that we need to, and and just looking after each other, really, and supporting.
Yeah. Let's hear from you, Tapu.
Yeah, I think the biggest thing for me is Talanoa. Like real big, and particularly for our community, is just to Talanoa converse in terms of what we're feeling. So people that know stuff, just Talanoa with others. I think social media is quite a massive platform now where people are sort of engaging in that. But for me, probably across our Pacific community, is just ensuring that the it's laid out, the mat's laid out, and they have their space for everyone to come in and Talanoa. And like Dr. Appi said before, man, we're leading the way. We led the way, and we'll probably lead the way again in terms of this time round. And so just that confidence from the first time and the learnings and that we're gonna be okay.
Thank you, Tapu, and you're right, Talanoa, talk with each other, and I think it's also important before we move on to make sure that when you Talanoa, that you're Talanoa, well, I don't know if that's the right word, but that the source of your information is correct as well. I think that's important too. Let's hear from you, Sally. What would be your advice, especially from a young person's perspective?
I think just coming from a young person's view is to a young person going again into this, remember that we are always on social media, but sometimes it's good to be off. Take time offline is always good. I know Reni's taken some time offline, which I aspire to do within the next couple of lockdown period that we have, and also remembering that that your information is important, where you are sourcing it to is very important. Be kind when we go out, respectively to our essential workers in our supermarkets, our healthcare workers, our police. Like, we have to just remember that they are on the forefront as well as us, just trying to get necessities and essentials through.
Thank you, Sally. Kindness, 100%. Fereni, what would be your advice around being calm in our community?
I agree with Sally on being kind. It's important that we remember, I think Dr. Bloomfield, he quoted on it, people are not the problem, it's the virus. And like my pastor said, that this is not the time to blame people. And if we remember and our understanding of the fact that people have their own issues going on in their lives beyond the virus, then we should be able to just respect them, be kind. And I know we've all said we've been here before, but that doesn't necessarily need to use the same mindset. It was crazy how people still panic. They still panic about things. Literally minutes after Jacinda announced that it was a 3-day lockdown. That was crazy to me. Like, come on, people. We don't need to use that same mindset. We've been through it before. Improve your mindset. Use a different one and use a better one.
Yeah. I don't know. What do the young people do? They do finger clicks for that type of stuff. And finally, from you, Dr. Appi, because I also remember in this afternoon's media update from Dr. Bloomfield talking about the anger and the reaction towards health workers as well. So, what's your word of advice?
Yeah, I mean, it's nice to hear it from, Sally, about being kind to each other. We don't know what the person next to you in the supermarket is going through, and they might want to push in front. So just, chill out and give them a bit of a leeway. I personally haven't noticed it this time. I know the last time we went into lockdown, there was a lot of anger because of the changes. People were ringing and abusing nurses and receptionists, but not so much this time. People seem to accept it. I've been reassuring people, saying, look, the case is contained. We know that people have contacts, and the health officials are trying to contact trace. I mean, Fereni gives a good example. She heard that the church was a contact, and so she's gone to get tested. People that are positive are put in quarantine so that they can be looked after properly, and sort of the opportunity that the virus spread is minimized. I really like what Ashley said, and I think someone said it here. It's the virus that's the problem. The people are the solutions. So out of us will come the solutions, but it has to come out of our genuine care for each other.
Thank you very much. Thank you very much to everybody tonight. And I just want to reiterate again around testing that if you don't need to be tested and you don't have the symptoms, then please don't go and get tested, because that just clogs up the system as well. But we do want to stress that if you do have symptoms, Dr. Appi, what's those golden rules again?
Good hand washing, cough into your elbows, social distancing, and contact tracing.
Yes, contact tracing is super important. But I just want to say thank you very much to our panelists tonight. Sorry we couldn't do this live, but really, really appreciate the time you've taken out tonight from your families as well. Especially, we just want to say thank you very much, and thank you for sharing your words of wisdom and your experiences tonight. So thank you, and keep safe.
Thank you, Johnson.
Thank you, Johnson.